Okay, this is Chapter 2 of the ATI Community, Social Determinants of Health. Social determinants of health are factors within a community or defined location that affect individual health. These are divided into 6 categories: social and community context, neighborhood and built environment, health and healthcare, economic stability, food and nutrition, and education. These factors impact risks and outcome associated with health, daily functioning, and quality of life. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Vulnerable populations are at greater risk for poor health status, limited access to healthcare services and nutritious foods, and significant disparities in life expectancy, morbidity, and mortality. Racial inequalities are associated with vulnerabilities. Inequities impact access to a range of social and economic benefits such as housing, education, wealth, and employment. Racial and ethnic minority groups experience higher rates of illness and death across a wide range of health conditions when compared to their white counterparts. Nurses can use the concept of social justice to ensure that vulnerable populations are included in equitable allocation of resources within a community to reduce health disparities. Social and community context. The Office of Minority Health has requirements for culturally and linguistically appropriate services. Class standards promote development of a healthcare workforce that can respond effectively to the needs of a diverse client population. Class standards include providing language assistance and information to a client in their preferred language and throughout the delivery of healthcare. Class standards promote ongoing improvement and accountability for culturally appropriate care. Congruency between culture and healthcare is essential to the well-being of the client. The link between health beliefs and practices is generally greatly influenced by an individual's culture. It is important to assess cultural beliefs and practices when developing a plan of care. Understand that there are variations within each culture. Consider the uniqueness of each client. Become familiar with cultures represented in the local community. Cultural competence. Cultural competence is a skill the nurse develops in learning to respect individual dignity and preferences, as well as acknowledging cultural differences. The provision of culturally competent care requires nurses to be responsive to the needs of clients from various cultures. Culturally competent care is guided by these dimensions: cultural humility, cultural preservation, cultural accommodation, cultural repatterning, and cultural brokering. Cultural humility is appreciating, understanding, and considering partnering with clients from cultures different than the nurse's culture. Cultural preservation, assisting the client to maintain traditional values and practices. Cultural accommodation is supporting and facilitating the client's use of cultural practices that are beneficial to the client's health. Cultural repatterning is assisting the client to modify cultural practices that are not beneficial to the client's health. And cultural brokering is advocating, mediating, negotiating, and intervening between the client's culture and healthcare culture on behalf of the client. Nurse leaders can use cultural competency in creating and working with a diverse workforce that can meet the needs of a diverse client population. Cultural assessment. A cultural assessment provides information to the healthcare provider about the effect of culture on communication, space and physical, contact, time, social organization, and environmental control factors. It is important for the nurse to become familiar with culture represented in the local community and how cultural factors can affect the effectiveness of nursing interventions. Prior to collecting information about a client's culture, the nurse should perform a self-assessment and ask the following questions to prevent personal bias. Am I aware of my culture and views about other cultures? Am I able to perform a culturally sensitive assessment? Do I have the knowledge necessary to develop culturally appropriate nursing interventions? What is my goal in learning about diverse populations? Environmental control indicates the belief in how the environment affects the individual. Individuals who believe that the environment can be mastered to affect health status will actively engage in health promotion, disease prevention, and treatment. Individuals who feel that their outcome is predetermined and they cannot affect it or are not as likely to engage in health-related behaviors. Individuals who believe in harmony with the environment are more likely to look for naturalistic solutions to correct what is perceived as an imbalance between the mind, body, and spirit. Time of orientation describes whether an individual focuses more on the past, the present, or the future. Individuals who focus on the past or present can have little interest in health promotion behaviors, which are described as having benefit in the future. Social organization describes the significance of individual members of a family or the family as a whole. Social organization often affects how decisions are made within a family or group. The nurse should understand that decisions about a client's health might be made by an individual other than this client or by the group. The nurse should... Sorry, there's something in my eye. The nurse should plan to include in teaching and decision-making any individuals the client dictates as important to the process. The nurse should understand that the client might make decisions based on the greater good of the family or group rather than self, and should respect the client's choice. Health beliefs and practices. These vary among cultures. Whatever an individual believes is the cause of impaired health will affect actions the individual will take to treat or prevent disease. Biomedical beliefs, naturalistic beliefs, and magico-religious beliefs. So biomedical beliefs about illness focus on identifying a cause for every effect on the body, that the body functions like a machine. This is the basis for the way the majority of medical facilities in the U.S. function, and is based on identifying a biophysical cause and treatment for health problems. Naturalistic beliefs about illness relate to the individual as part of nature or creation. An imbalance in nature is believed to cause disease. This is the basis of Eastern or Chinese medicine. Several other cultures, such as the Mexican culture, follow the hot-cold theory of balance in relation to health and illness that accompanies this belief framework. And magico-religious beliefs about illness link health to supernatural forces or good and evil. This includes belief in faith healing used by some Christian religions, or voodoo and witchcraft practices used in Caribbean nations. Biological variations in health can be linked to genetic ties from biological relatives, include growth and development, lab test findings, skin color, and susceptibility to disease. Cultural assessment parameters: ethnic background, religious preferences, family structure, language and literacy needs, food patterns, health promotion, types of health practitioners used, medicines, treatments. Steps of data collection. The first step of the cultural assessment is collection of self-identifying data about the client's ethnic background, religious preference, family structure, food patterns, and health practices. Next, the nurse should pose questions that address the client's perceptions of their health needs. The final step of the data collection process is identification of how cultural factors can affect the effectiveness of nursing interventions. Nursing interventions. Establish partnerships with community organizations and engagement, neighborhood associations, social media pages, after-school and extracurricular activities, and identify programs that aid in time of stress and crisis, emergency housing, financial assistance, and vulnerable populations. Conveying cultural sensitivity. Address the client by their last names unless the client gives the nurse permission to use other names. Introduce yourself by name and explain your position. Be authentic and honest about what is known or not known about the client's culture. Use culturally sensitive language. Find out what clients know about their health problems and treatments and determine the client's intent to adhere to the prescribed treatment plan. Incorporate clients' preferences and practices into care when possible. Do not make assumptions about clients. Encourage clients to ask about anything that they might not understand. Respect clients' values, beliefs, and practices. Show respect for clients and support systems. Provide health teaching materials in the client's primary language and at the recommended readability level. Using an interpreter. The nurse should use an interpreter when it is difficult for a nurse or client to understand the other's language. Interpreters should have knowledge of health-related terminology. The use of family members as interpreters is not advisable because clients might need privacy in discussing sensitive matters. Family members can lack objectivity when relaying information to or from the client, and the family member can have difficulty understanding medical terminology. The nurse should consider client preferences when selecting the age and gender of the interpreter. Interpreters should not be from the same community as the client. Differences in socioeconomic status, religion affiliation, education level, and spoken dialects can result in translation barriers. Federal government mandates regular agencies to have a plan that will improve access to federal health care programs for individuals who have limited English proficiency. Subcultures might have conflict. Neighborhood and built environment relates to the quality of the air, land, water, and other surroundings with which people come into contact. It addresses positive factors such as the presence of sidewalks, bike lanes, and green space, and well as determined factors such as crime and violence, as well as an area industrial complexes, which can decrease the quality of air, ground, and water. Additionally, this refers to the accessibility of transportation and grocery stores that sell healthy foods. Nurses identify environmental health risks, participate in research, and use advocacy to improve environmental quality. Nurses can contribute to environmental health by using environmentally friendly practices and materials, as well as providing information to the public about environmental health. Toxicology considers how exposure to chemicals can have negative effects on health. Nurses use toxicological information to understand the specific effects that environmental hazards have on populations at risk or following exposure. Data collection. Accessible, safe, and clean parks and public spaces, homes and workplaces built to code, low crime rates, access to potable water and sewage facilities, safe traffic patterns. Environmental risks are toxins, air pollution, water pollution, and contamination. Toxins is lead, pesticides, mercury, solvents, asbestos, and radon. Air pollution is carbon monoxide, particulate matter, ozone, lead, aerosols, nitrogen dioxide, sulfur dioxide, and tobacco smoke. Water pollution is wastes, erosion after mining or timbering, and runoff from chemicals added to the soil. Contamination is food and food products with bacteria, pesticides, radiation, and medication, growth hormones, or antibiotics. Roles for nurses: facilitate public participation in measures to improve the environment, perform individual and population risk assessments, implement risk communication, conduct epidemiological investigations, participate in policy development. Oh my God, how much more? Assessment. The I Prepare mnemonic is one method of determining current and past environmental exposures. I is investigate, present work, residents, environmental concerns, past work, activities, referrals and resources, and educate. So investigate potential exposures. Present work, exposures used of the personal protective equipment, location of safety data sheets, hazardous materials brought home from work on clothing, trends. Residents, age of home, heating, recent remodeling, chemical storage, water. Environmental concerns, air, water, soil, industries in the neighborhood, waste site or landfill nearby. Past work, exposures, farm work, military, volunteer, seasonal, length of work. Activities, hobbies, activities, gardening, fishing, hunting, soldiering, melting, burning, eating, pesticides, alternative healing and medicines. Referrals and resources, Environmental Protection Agency, Agency for Toxic Substances, OSHA, Local Health Department, Poison Control. Educate, risk reduction, prevention, and follow-up. All right, so primary prevention. Educate individuals to reduce environmental hazards. So educate groups to reduce environmental hazards, advocate for safe air and water, support programs for waste reduction and recycling. Secondary prevention. Survey for health conditions that can be related to environmental and occupational exposures, maintain environmental health histories of individuals, monitor workers for levels of chemical exposures at job sites, and for the community, survey for health conditions that can be related to environmental and occupational exposures. Tertiary prevention, individual. Refer homeowners to lead abate resources, educate clients who have asthma about environmental triggers. Community. Become active in consumer and health-related organizations and legislation related to environmental health issues. Support cleanup of toxic wastes, sites, and removal of other hazards. Global health. Healthcare delivery and health problems around the world affect the health of countries. Global health initiatives can be used to improve health status worldwide and promote equity in treatment. Examining the years of life lost from early death and disability provides information about the global burden of disease. Influences on global health, wars and political unrest, natural natural and man-made disasters, limited resources and structure in lesser developed nations, international travel, sanitation practices, climate change, maternal health, and nutrition. Goals for global health. The United Nations created the Millennium Developmental Goals, which called for more developed nations to contribute resources to improve conditions in lesser developed countries, making global health a responsibility of nations around the world. In 2015, the goals were updated and replaced with a new list of sustainable developmental goals: eradicating hunger, making primary education available, promoting empowerment of women, developing global partnerships, making safe human settlements in cities, combating the effects of climate change, and promoting peaceful, just societies. Nursing interventions. Support the development of healthcare roles in countries with lack healthcare professionals. Promote the benefits of nursing as a distinct profession in health promotion. Work with government, foster programs, act as mentors. Access to and quality of healthcare. The goal of primary healthcare system is to make healthcare available in close proximity to people who need it, and to ensure that it is comprehensive with flexible costs to accommodate the income variations of the individuals who use those services. Community health nurses must advocate for improved access to healthcare services. Data collection. Community assessment includes evaluating the adequacy of health services within the community and the accessibility of those services by those needing access. Inadequate healthcare insurance, inability to pay for healthcare, cultural barriers, lack of communication tools, eligibility requirements for state and federal assistance programs. Okay, organization and financing. Although providing healthcare is a human service, healthcare delivery is also a business. Affected by economic influences, good health status in turn positively affects the economy by increasing the individual's potential for productivity and wage earning. So there's microeconomic theory and macroeconomic theory. Microeconomic theory examines individual preference and finances and how those actions affect cost of care and resource distribution. Macroeconomic theory focuses on aggregate behaviors, economic growth, and employment. The cost associated with the healthcare is a barrier to care for many. Some providers ration healthcare and only offer services to individuals with certain coverage types. Organizations. The healthcare system in the U.S. is influenced by federal and private organizations as well as global health organizations. Like WHO provides daily information regarding the occurrence of internationally important diseases, establishes world standards for antibiotics and vaccines, primarily focuses on the healthcare workforce and education, environment, sanitation, infectious diseases, child health, and primary care. Veterans Health Administration finances health services for active and retired military. The U.S. Department of Health and Human Services, under the direction of the Secretary of Health, funded through federal taxes. Administration for Children and Families. This is the ACL, supports the needs of the aging and disabled populations and improves access to health care and long-term care for, this is also for community living. Centers for Medicare and Medicaid Services also administers the Health Insurance Portability and Accountability Act, which is HIPAA, disability insurance, aid to families with dependent children, and supplemental security, SSI. Agencies for Healthcare Research and Quality conducts research to improve the quality, affordability, and safety of healthcare services, uses research data to publish clinical guidelines and recommendations for a variety of healthcare conditions. Oh my God. State health agencies. State Department of Health obtain funding from state legislature and federal public health agencies. They manage the WIC and children health insurance programs. Local health department receives funds from state level to implement community level programs. The primary focus of a local health department is the health of its citizens. Local health departments are responsible for identifying and intervening to meet the health needs of the local community. Financing for healthcare can come from a variety of sources, including individual payment through organized insurance, and health maintenance organizations and public funding. Affordable Care Act is the Patient Protection and Affordable Care Act, was created to help make health insurance affordable for all people and decrease the amount of federal spending on healthcare. It affects the way Medicare benefits are implemented and the way private insurance companies supply coverage. The full law is available through the U.S. Department of Health. Important elements of the Affordable Care Act: extending eligibility for dependents to remain on parents' insurance until 26, prohibiting health plans from denying benefits for pre-existing coverage to children under the age of 19, banning lifetime limits on benefit coverage, and covering preventative care services. Private funding, health insurance employer benefits, based on using a case management approach with a specific group of providers in an attempt to contain the cost of care. This is HMOs, which is comprehensive care, is provided to members by a set of designated providers. PPOs are predetermined rates are set to a service delivered to members, and medical savings accounts are untaxed money to put in an account for use of medical expenses. Economic stability is related to the ability to access resources for life, such as money, housing, food, and a job that provides consistent living wage. Poverty and homelessness. The federal poverty level is used to help determine which individuals can receive financial assistance, like Medicaid or welfare. Individuals living in poverty are unable to pay for food, transportation, shelter, clothes, and medical care. Community regions that are characterized by poor housing, low employment rates, and increased rates of death and disease can be described as neighborhood poverty. Health care for individuals who are impoverished or homeless is often only in times of acute exacerbation of crisis. Poverty, characteristics of individuals: insufficient insurance coverage, high-risk work and living environments, poor nutrition resulting from food insecurity, less likely to engage in preventative activities or seek treatment for health problems. Nursing actions for preventing poverty and assisting individuals living in poverty. Coordinate free or low-cost health services and providers. Coordinate collaboration with businesses and other employers to improve working conditions. Collaborate with available resources that address housing insecurity. Health issues of homeless populations: upper respiratory disorders, TB, skin disorders like scabies and lice, HIV, AIDS, mental health disorders, dental caries. Prevent individuals and families from becoming homeless. Alleviate existing homelessness by making referrals for financial assistance. Prevent reoccurrence of poverty, homelessness, and health problems that result in conditions of poverty and homelessness. Rural areas typically have less than 20,000 residents. Frontier areas have less than 6 persons per square mile. Urban areas typically have 20,000 to 49,999 residents, with larger central cities having a population of 1 million people or more. In general, low population densities are linked to decreased access to care, decreased health status, and health decrease seeking behaviors. Food securities include availability of food and nutrients, access to healthy food options, reliable sources of food. Food insecurity is limited access to affordable, nutritious foods. In 2020, in the United States, 10.5% households experienced food insecurities at some time during the year. For children, food insecurity affects physical development and ability to learn in school. Higher rates of food insecurity occur in households with incomes near or below the poverty line, in which the head of household is a single parent, or in large metropolitan areas. Social factors that may affect nutritional requirements and intake is low literacy levels, language barriers, lack of social support, limited or low income, advanced age, lack of options for physical activity. Food deserts, urban area and rural area. Urban areas, community members live at least 1/2 mile from supermarkets or grocery store. Food deserts may have stores and restaurants that provide high-calorie, low-cost foods with low nutritional value. Rural area community members live more than 10 miles from the supermarket or grocery stores. Healthy People 2030 objectives: reduce household food insecurity and hunger, and eliminate every low food security in children. Social and community context: access to programs that aid during times of crisis, support groups, neighborhood associations. Neighborhood and built environment: safe, clean, and accessible parks and public spaces, safe traffic patterns. Economic stability: diverse and multiple jobs opportunities, salaries that can cover the cost of living for that area. Food and nutrition: availability of food and nutrients, access to healthy food options, and access to quality of education. Schools with strong retention and matriculation rates. Institutions of learning that have adequate supplies, and access to libraries.